We at the Virginia Spine Institute have asked a lot of patients to give us testimonials about their success with spinal surgery. I felt that it was important for me to give my own testimonial since I myself have been a patient and a recipient of spinal surgery. I have the benefit of having parents who have a lot of degenerative disc disease, and so because of that, I inherited their degenerative discs, and I have had problems. Being a spinal surgeon requires operating at a table for many hours with our neck bent, working on patients for 10, 15, 20 hours a day sometimes. And after doing that for greater than 20 years, my disc started to fail in my neck, and I ended up with severe disc problems in my neck. The result of this was that I was having progressive weakness and numbness in my arm. A bad problem for somebody who requires on significant dexterity of their hand for their livelihood and to be able to render successful treatment to patients. So after I failed to respond to non-operative treatment, I had to make a decision on what to do. Well, who knows better about the anatomy, the pathology, what works, and what can go wrong with surgery than a spinal surgeon who does this every day for himself for a living? Well, fortunately, I knew the surgeons at the Virginia Spine Institute, Dr. Brian Subach and Dr. Michael Haas, were excellent physicians who I trusted my life in and had them operate on me. Through a minimally invasive technique, they were able to go in the back of my neck, remove the pinched nerve, free up the nerve, and restore function back to my arm. The good news was, in that technique, within 2 weeks, I was able to be back at the operating room table helping other people. I've worked with spinal surgeons from across the country. I've worked with surgeons from around the world. And I know that the surgeons that I picked were the best in the business to render my care safely and appropriately in the least invasive fashion possible. It is because of that that I am proud to be a part of the Virginia Spine Institute, as well as proud to be a recipient of their great work.